Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. Well, on your screens right now, I'm showing you a fantastic X-ray. I saw this patient today, a 72-year-old female. She had a slip and fall at home in washroom. She fell flat on her buttocks. After that, she's been complaining of immense pain in her back. So we got an X-ray done, and in the X-ray, what we can see is a very, very interesting thing here. We can see a very important point that there is a significant collapse in the vertebral body height, which I'm sure you all can see right now. You can see this vertebral body height, you can see this vertebral body height, but this is an osteoporosis induced collapse, compression, fracture of a vertebral body leading to significant reduction in the vertebral body height. In other ways, I can tell you that this is actually a wedge fracture. So you can see the anterior wedging, the vertebral body height has been compromised, almost hardly 10%, 15% height is remaining. It's a pathological fracture. Normally, if you or me would have fallen down, we wouldn't have something like this, because this is the problem in our old women, osteoporosis. So coming back to a couple of MCQs, what is this kind of a fracture? Wedge fracture. Is this a normal fracture or a pathological fracture? Pathological fracture. What is the most common cause? Osteoporosis. What is the most common site? Spine. Which spine? Thoracic spine. Upper or lower? Usually lower. Which level? T12. I hope you got this clear. How are we going to treat this? First of all, we should see that whether there is any involvement of this injury into the neurological canal. Therefore, we have to look at the spinal cord. So keep an observation on the sensory aspect, on the motor aspect, and if you feel anything is there, then get a CT scan done, get an MRI done. Probably it might be the retropulsion of the fragment in the spinal canal. That might be the reason. Most of the cases don't come with this. Most of the cases just have a wedge compression fracture and nothing else. In those cases, all what we do is bed rest minimum for a period of 2 to 3 months, and even if you have to get up, you can get up after a month or so, and you can wear a tailor's brace. But apart from that, you have to treat the underlying cause. And by the way, what is the underlying cause? Osteoporosis. Bisphosphonates are very effective. They're always a drug of choice, but in this situation, when there is such a severe osteoporosis, daily administration of subcutaneous teriparatide 20 microgram in a pre-filled injection form is, I think, very ideal if you combine it with bisphosphonates. So that is how you treat the underlying problem. As far as pathological fracture is concerned, you can't really do much about it. Just let it heal. Make sure the patient is immobilized by that time. I hope you understood the approach to this case that I saw today in my OPD. I wanted to share with all of you. I wish you all the best.